Hello, everybody. My name is Dr. Harriet K. Gabone. I am the President, CEO, and founder of Dr. Gabone Quality Healthcare Solutions and Consulting, which was founded in 2019. We are focusing on educating and training healthcare workers globally. We have been conducting medical missions under the organization. This will be the second medical mission into Tanzania, scheduled for September 12 to September 23rd. We have so far about 24 global volunteers, and we're excited and blessed to have all of them. We are going to focus on educating and training healthcare workers in Dar es Salaam. We will be working on 3 hospitals, and then also we're going to be going to community outreach programs, which include going to one of the primary school. And at the primary school, we'll be focusing on hand washing, dental hygiene, nutrition, and vision screening. At the hospitals, we'll be focusing on the Help a Baby Breathe, thermoregulation, diabetic screening on the pregnant women, postpartum hemorrhage, and addressing emergency responses. So we are all so excited, and we are collaborating with our colleagues in Tanzania. We have started training now, and we are trying to upload all the theory part, and then when we get to the country, we'll be doing hands-on skill demonstration and evaluation. And we are here today at the Salem Community Church, and we are so honored to come and share our passion and goals for this Qhsc organization. Thank you very much, and listen in.
So just to give a brief before Ms. Valentine starts speaking, that's just a map where Tanzania is. It's East Africa. It's right there in the equator. So we did the first mission, the last mission on 2021 in Dodoma, which is the middle of the country. It's almost like you're going like in Ohio in the United States. And then now the next medical mission, we're going to go to Dar es Salaam in September, which is in the coast. Somebody, Ms. Valentine, continue.
Okay, so last year I had the pleasure of joining the medical mission. It was my first mission ever, but I knew since a young girl that serving a mission is something that I've always wanted to do. So I met Dr. Gabone through my nursing program, and I found out about everything that she was doing, and I was inspired, and so I asked her if I could join. So the medical mission that we went to in Tanzania allowed me to have the pleasure of teaching newborn thermoregulation to mothers who had just given birth. The babies are not able to regulate their body temperature the way we are, so it's important that we help them by keeping their heads covered, their hands covered, their feet, and wrapping them in like a blanket. So, as we say in our Haitian culture, "Faut chauffer petit plat." So, in order to promote this, we basically we gave out the donated onesies, mittens, socks, diapers, the caps, and blankets to give to the mothers and babies. We also taught dental hygiene, the proper way to wash hands to school-aged children, and we encourage healthy habits and prevent illnesses by doing so. So this year, unfortunately, I'll be missing out because I'm expecting, but thank you. So this year, for this trip, Dr. Gabone is going to share some of the things that we're hoping to collect. And so we're offering an open invitation to you all, to anyone who would like to provide their expertise and their time or supplies or whatnot. Go ahead, Dr.
So just what Ms. Valentine just finished saying is, we want to see from her contribution to fit in the organization. Next slide. Okay, so last year, this is what we did. We collected a number of things. We did a number of education. You can see on the list. There was 20 global volunteers, which 10 from the United States and then 10 from Tanzania. We were able to do training for 13 days, and we were able to see almost 2,067 people, including nurses, doctors, community outreach children. Each one of the schools, like 1,600 kids, which we were able to provide what Ms. Valentine just said, dental hygiene and hand washing. And we have spent almost 8,833 hours to providing care for this. And when we were recruiting people, we were saying, Ms. Barrington was saying, okay, I'm just a nursing student. What am I able to do? She did a lot. And there's some videos here, unfortunately, I might not be able to play, but she did a lot. She mentioned about teaching the new mothers how to band up their babies. So we do take it for granted here in the United States. Oh, we're blessed enough to have the resources to be able to cover the babies. When the baby comes out, we don't think twice. We have the mittens, the diapers, we just reach over. And the people from Tanzania don't have that option. So Ms. Barrington was able to raise a lot of money last year and be able to buy the bundle for these kids, which included the hat, the onesie, the diaper, the cloth, Tanzania. So she was able to give for all the babies who were born, 40 of them, and she was able to teach them how to do that. That was great. Next slide. So this is one of the training also Ms. Barrington is teaching young athletes, soccer players to eat healthy and prevent minor injuries. We all know that children, when they're playing, they want to play, but if they have injuries, they are going to afraid to say that they're hurt, so they're going to continue playing. So Barrington is on the team of other volunteers teaching these children that you have to identify if you're hurt. You have to notify your parents, your teachers, your coaches, so you can prevent further injuries. So she was able to teach all the young people to feed eating healthy. And we know the kids usually like to eat pizza all the time, or not drinking soda or Nordic soda. Ms. Barrington is teaching in the school. Those are 1,600 kids who she was teaching them dental hygiene and hand washing. Teaching it in English, and of course we had another nurse who was translating for the kids, and then she was teaching them what wash your hands. So the children were so excited to sing in English because we don't speak in English. So Ms. Barrington is blessing them with English songs. On the left side, I'm going to let Ms. Barrington give a story about helping a woman deliver, and she'll give you the differences.
Oh, yes. So this particular day, I will never forget. She was like, we have to go because it was a group of us, and it was time for us to go and eat dinner at the hotel. And I was like, I can't leave her. Like, we cannot leave until she has this baby. So we stuck around, and the baby was safely delivered. But one thing I noticed is that, like, in the hospital, here in the hospitals, we get to have privacy. It's a big thing to have privacy, but over there, you know, everyone's just exposed to see what's going on. And one thing I'll never forget that hit close to home for me was the whole entire time that the woman was in labor, and she was sweating. And I'm like, where's the AC? Like, we have to help her. And I just thought about myself when I had my son, and I said, we have to just find whatever way we can to help her. And so the whole entire time, Catherine and I, we took turns like fanning her, and she was just so happy to have us there throughout the whole entire process. And yeah. And turns out she named her baby after my son Logan. That's how happy she was. Next slide, please.
So it's unfortunate that pregnant women, when they deliver in Tanzania, they don't get the same care that we here in the United States. A very simple situation that you hear the parents or the family members of the pregnant patient saying, oh, she's going to have a baby, she may come back home. So that may is a huge challenge for them. That means they don't know if she's going to deliver and be able to raise that child, or she may come back home with that child. There's 50% of moms who are delivering die from postpartum hemorrhage. It's a very preventable problem, but in Tanzania, a lot of moms die. And so they see as a normal thing. Well, unfortunately, she's gone. So that's something that we really try to change, because there's a lot of things that you can do even without resources, like breastfeeding, making sure you identify patients who are at risk. If they are diabetic, you will address that from before they deliver. Or if there's anything that you can provide to teach them before they during the labor, and then after the delivery, we need to monitor them. So those are part of our education when we were going to Tanzania again. So this is one of the lessons that we were teaching at one of the hospitals called Kongwa, and we were teaching the doctors and nurses how to identify and to see after the patient delivers how much is too much bleeding. So yes, when you deliver and you're going to bleed, then how much is too much and what you need to identify. So those are some of the things that Ms. Vine and the other groups, even if she was a nursing student, she was able to teach the moms how to check your fundus to make sure you're not bleeding too much. If you need to go and void after the delivery to make sure your uterus stays in place, then those are basic things that we take it for granted. My nursing students know that, but of course in Tanzania we have to go and share that information with the doctors and nurses. So it was a enlightening, it's a very sad situation really. Next slide. So that's just part of the group of the global volunteer that we were there to go and see, to complete a mission last year. And then, so these are the list of the things that Valentine is going to finish it up with. And then, next slide.
Yes, so again, so some of the things that we're collecting are things to promote newborn dental regulation, like I mentioned earlier. Diapers, blankets, socks, mittens, caps. We're also collecting school supplies for the children. We're in need of backpacks, crayons, pencils, notebooks, simple things like that that they don't have the luxury of having. And yeah. Oh no, I did miss something. The toothbrushes and the toothpaste. I need those. Yeah. So we're also collecting toothbrushes and toothpaste. I'll never forget last year when we went and we gave the children backpacks. Their faces lit up. They were so happy to have like pretty backpacks and the toothbrush and the toothpaste. And so I said, well, who gets excited about over a toothbrush? And then that's when I learned that some people don't have that opportunity to have a toothbrush, so they have to use other means. And that hurt me to the core. So this year I said, we have to try harder to give out more. And so that's why I said, you know what? We need to start spreading the word. And that's why I asked Reveline Dantes, my little sister, thank you, Reveline, So thank you so much. We're going to stick around, and towards the end of the service, I'll be outside, and if anyone's interested.
Again, big thank you to everyone for your ongoing support. Until then, and enjoy your family and be safe.